Welcome to the latest edition of the Mind-Gut Conversation podcast, a place to learn about breakthroughs in the science and practice of health, mind-body interactions, the microbiome, food, and the environment. Today, I have the great pleasure to talk to Dr. Uma Naidoo, author of the book, This is Your Brain on Food. Dr. Naidoo is a board-certified psychiatrist, professional chef, and nutrition specialist who holds several positions. She's currently the Director of Nutritional and Metabolic Psychiatry at the Massachusetts General Hospital, where she consults on nutritional interventions for the psychiatrically and medically ill. She's also Director of Nutritional Psychiatry at the Massachusetts General Hospital Academy and in private practice. In addition, she teaches at the Cambridge School of Culinary Arts. She blogs for Harvard Health and Psychology Today and has just completed a unique video cooking series for the Massachusetts General Hospital Academy, which teaches nutritional psychiatry using culinary techniques in the kitchen. Finally, she has appeared as a mental health and nutrition expert on multiple podcasts and has been featured in the press. Yeah, so welcome to the show, Dr. Naidoo. I may call you Uma.
Please do. Thank you.
It's a real pleasure talking to you today about a topic that I guess both of us are interested in and have written about. So it's really nice to exchange our views and opinions on this important topic of nutritional psychiatry. You're uniquely qualified as a nutritional psychiatrist because you sort of have this triple threat, being a board-certified psychiatrist, a nutrition specialist, and trained chef. And I would add a fourth to it. You have a family tradition of, being exposed to healthy cooking and cuisine. So it really makes you a uniquely qualified individual. And
Thank you.
I should also start out with, the book that we'll be talking about. This is really, I would highly recommend this as reading material for anybody who's interested in how much what we eat actually influences how our brain functions on a daily basis. So let me start out with something personal. How did you end up with this unique trajectory?
It really does go back to those healthy eating days in my family without realizing it. I grew up around my grandmother, to whom my book is dedicated. My mom was in medical school during the day, and I would watch her prepare meals from scratch, pick vegetables from the garden, have a sense of community. We'd eat lunch together. My grandparents would entertain me and teach me yoga and meditation, so they would keep me busy. So sort of came into mental health training with this background that was very integrated and holistic. I didn't realize those were the words at the time, but I kept asking why we were not speaking to our patients about more things, not just pulling out a prescription pad, but asking about what they were eating, were they exercising, not just a social history, but much more than that. And I, pursued things that I really enjoyed doing, and early on realized there was a gap in our education because we just simply don't know enough about nutrition. But the culinary school part was really my fondness for Julia Child, whom I used to watch when I was studying. Not being able to afford cable television, I'd watch her on public television in Boston. She was great, not only a great chef, she was very entertaining, and it gave me confidence as a young cook. And when I realized that she did this much later in her life as a second career, I thought, why not me? But, the fact that it became so integrated in my career, in many ways, hindsight is 2020, and putting it together was the blueprint of the work that I do today.
You mentioned a couple of times the sort of lifestyle that you grew up in, eating meals in the family and community, and which are obviously very important factors, that so in science we call them confounding factors, which is kind of but we find the same thing with the Mediterranean cuisine. If you ever, go to any of the Mediterranean countries and
Yes.
enjoy a meal and watch people how they eat and meet friends, and um, so dramatically different from the way we do this here in the US. I mean, here the social contact or birthday parties where you generally eat the unhealthiest food, um, but it's not. It's not an integral part of the way humans interact with their meals. How much do you think that I would say non-food or non-biological component plays in the health benefit of
Yeah.
nutrition of diet?
I think it's actually much bigger than we think. Initially, one would think, well, it's just, maybe you don't have family, maybe you don't have friends that you can share meal with. But one of the things that COVID taught us was how isolation and quarantine was so much more difficult for some people than others. And a study that looked at the brains of individuals who did not have COVID but developed neuroinflammation anyway, I think was a real telltale sign that that sense of isolation and stress that was going on. So it wasn't just one factor, many. But these were individuals who did not even get the COVID infection. I think to me that spoke to the fact that even a sense of community and eating together, even if it is on Zoom with someone, say you live alone, or having a pet, or having a family that you can visit as restrictions are lifted, becomes important to just our mental well-being. Also, mindful eating. As a resident, as a psychiatric resident, I was a horrible eater. I was always eating on the run, eating too late, eating in the middle of the night. And when I think back to those days, despite what I knew, circumstances were sort of surrounding me in a way that I wasn't able to control that. And I think it starts with, being mindful, being planned, prepping your meals, carrying a lunch, enjoying preparing meals together with friends, family, whoever it is. I think that brings a very important factor to how we enjoy our food. We also eat too fast. I mean, I find I have to remind myself, and that's been shown to impact digestion. We know that much, but I think that all of those factors often get overlooked when we think about just the medical facts only.
Yeah, I've sort of looked into the literature and have sort of gone back and forth myself. I mean, how much are these relative components contributing to the
Mm,
so right now we're in this almost like enthusiastic embracement by the lay public,
mm,
really, of this nutritional psychiatry concept, less so by the psychiatry specialty, and
true, true.
even less so by my specialty, gastroenterology. um, and I've struggled with this. There's the social component, there's the psychological, there's the expectation, um, there's the memories of food that we have often associated with positive memories in childhood. So when you eat something, it
Mhm,
brings back that. And how much is actually related to the actual component of food, which is so complex. What we know now, there's thousands of polyphenols, there's hundreds of
and
different fiber molecules. Each
it,
of them require different kind of microbes to break them down.
yeah,
So what are the relative roles of this? This is something, quite
yeah.
honestly, I've not found the final answer to yet.
And
Uh,
I think that's not only a great question. I think it speaks to the fact that this is a really nascent field. And you're absolutely right, it is not fully embraced by just mental health professionals. I think a lot of younger professionals are very interested in more lifestyle factors because they are seeing how speaking about exercise or mindfulness or forest bathing or hydration with their patients makes a difference. But when we look at the actual food, my position on it is we don't know everything. It's not a prescription for your mental well being. but it is something that can work to support forms of therapy, which I feel are very important, and certain medications, which I feel have saved the lives of many of my patients. So it should work collaboratively with everything else, but it's a factor that's been ignored. Yet psychiatrists and other physicians who prescribe medications, psychotropics, are constantly trying to catch the side effects, like the weight gain, like the sexual dysfunction, instead of almost thinking about it a little bit in reverse. Like, is the individual, as they start medication, can they also be engaging in lifestyle factors? In To your point, Dr. May, it's true that every food can be broken down into so many nutrients, and then which microbe does it interact with? I think that as more research emerges, we'll know more. But what I've discovered is by putting someone on sort of a nutritional psychiatry plan of more healthy nutrients than not. We know there's a good amount of evidence for things like omega-3 fatty acids and depression and anxiety and even cognition. Doesn't make it a prescription, but I've noticed these changes clinically and improvement in how they're doing. So I feel like those things are what led to the vignettes that I could share in my book about what different individuals did. And I think also that where we're eating and we're eating several meals a day, why not do it in a way that could improve our mental well-being and see how we feel? Because the upside of it is people often lose weight. People often feel better. People may have a different need for the amount of insulin they're taking. Just it depends, of course, on the individual case. But I've had unusual things like that happen as I'm working with someone. So.
Yeah, I mean, the one thing that we're obviously missing in this field is there's lots of evidence now from often really well-designed. Many of these studies come out of Harvard Public Health School, these big epidemiological studies that show these associations between, in large populations, 20,000, Harvard nurses study, 20,000, 30,000 people. And we have the same studies, evaluating the Mediterranean diet. And what these studies show clearly an association between a healthy diet, let's say the Mediterranean diet, and better mental health, better physical health. What we don't have, or only in small amounts, are these mechanistic causative studies, like, interventions done at the same rigor as a randomized controlled trial for a medication. And
Great.
most authors, mention that and acknowledge that limitation. And there's a big demand and push by the NIH. We need intervention studies that look at the causality. Yeah. Does it actually make a difference if you're on a certain diet, or is it not just associated that if you are on this diet, you also have other healthier lifestyles that you pursue?
That you're pursuing. One of the things that I struggle with so much is that nutritional science changes all the time, but at the same time, there's no real impetus for there to be a huge amount of funding for nutritional science studies. And they are not nearly robustly funded as the big pharma studies are. So, when you think about different individuals who speak to this point, there are even conversations about how blood pressure parameters will be influenced by pharmaceutical companies so that they can push a certain sale of a certain medication. So I think that, I prescribe medications, and like I've said, they can be life-saving for certain individuals. I think that there isn't the great robust push to do these nutrition studies. There might be the interest from many of us, but these are not easily funded. So I agree with your point, and I feel that that is why I know that this is newer science, but also I'm hoping that some of the research that will be ongoing, like your work and others, and some of what we're doing, around the microbiome and around what we can learn about manipulation in a positive way of those gut microbes, what that will do for mental health. I'm really excited about, what could be done with psychobiotics, for example. And I feel like that could truly be a positive change for mental health. but we're still early.
Yeah, so yeah, I'm faced with that myself, that like probiotics or psychobiotics um, that are, have demonstrated positive effects, beneficial effects on mental health. So the companies that have that sell probiotics successfully, they generally don't have an interest to launch a huge, well-controlled, uh, randomized controlled study, because there's always the risk that it would not show the significant difference. And I've seen it several times now. I was invited to advisory boards on planned big studies, international studies on probiotics,
Yeah.
and then they were canceled in the last minute. So there was never a reason given, but
Interesting.
I think the most likely reason is that these companies, their boards, their business people did not want to take that risk as long
That
as their
chance.
product sells well. And so this is a
Right.
big dilemma. I mean, it's the same with
Right.
all the supplements, that.
Right. And the supplement industry is $1 billion industry, and it's not, as you all know, not regulated by the FDA. And people who, some of my patients do take probiotics, and I think that there is a role for them. But much of the time, we can get a lot of good benefits from food. And often, when someone's spending a lot of money on a probiotic, they don't realize they need to continue taking it for those positive effects to continue. They might take it and they might find it too expensive, or might find that they forget and they stop taking it. And any benefits that have evolved and changed in the microbiome just go back to where it was. So there are lots of sort of uh, people don't fully understand what they're getting into when they might purchase a probiotic or think about it. I will say, Dr. Mayer, that over the time that I've worked in this field, I used to be more of a purist and thinking that we should get everything from food, but I've also realized our diets are not perfect. We're facing environmental stresses and pollution and genetic factors and so many things. So we don't we try to eat healthy, we try to make healthier choices, but we may not eat a perfect diet. So there is a place for supplements. I just don't feel you can out supplement a bad diet. So you can't be eating, Cheetos and ice cream and then take a supplement and make it all better. I think that's sometimes the other mistake that people make.
Yeah, I think you make a very good point here, because so my feeling is, and I think I've written this somewhere, that if you stay on your standard American diet and then take supplements and probiotics, they're not more than a placebo, an expensive placebo. If you are on a
Yeah.
healthy diet, then there's a couple of possibilities. I mean, one is, if your diet is so healthy that supplements are not necessary, and they will not show, and this has been shown for flavonols, for example, in a recent big study, that people had a high baseline intake of flavanol containing foods,
Mm,
they didn't get an additional benefit in their
mm,
cognitive function from adding a supplement with flavanols.
mm,
So but I do agree with you. I mean, and I used to be more of a purist, to fully support natural diet related
mm,
interventions. But first of all, there's many people that don't have access to these diets. They don't, like, you live on the east side, we live on the west side. These coastal communities have access to things that
mm.
a lot of people in the south or in the central part of the country may not
They
have.
don't. Mhm.
And in that case, supplements are definitely, there's definitely a place for that, and very an important one. Uh, but if you had the choice, so if you have a patient who comes to you and you feel, this patient would benefit from a higher omega-3 intake, higher polyphenol intake, what's your first reaction? I mean, do you go to the diet recommendation, or do you say there's also supplements that you could take?
The usual. I'm generally a food first person, because also the way that my clinic is set up, it's more like a tertiary care center. So the individuals being referred to me really are coming for that nutritional psychiatry work. And very often they are individuals who've either tried healthy diets or they've tried supplements, but they're suffering in some way with symptoms and they've really not found a lot of help. And we know that research shows in mental health that about 50% of individuals who take a medication actually may improve, and about 25% of them continue to have symptoms. So, um, it's surprising that we continue to prescribe medications outside of other interventions alongside them. So knowing that, I think it becomes important for us to offer people more options, um, and that just I think that just is the way that we should be doing it. So I might talk about the types of seafood they could get, those omega three, and then if they're plant based, we know that the short chain omega threes, the ALA, are not as well converted from hemp seeds or flax seeds and that type of thing. So we a supplement in that case, if someone is plant-based, may be important. They should still eat for the fiber benefits and other benefits. They should still be eating all those seeds that are rich in the short chain omega threes, but they should probably consider a supplement as well if we're targeting depression and anxiety, for example. So yes, I'm a food first person, and if the individual is already taking a supplement, I don't. If they've had no side effects from it, they can continue doing that. But we can also implement things in the diet as well.
There's a lot of talk about personalized medicine,
Yeah,
individualizing treatments, and there's more and more a push to identify biomarkers that would identify subsets. And biomarkers could be anything from microbiome based or metabolite based or other inflammatory markers based. So the recommendations that you make in your various chapters for individual diseases, so they're kind of disease specific, but do you think also do you think this is personalized? So one person benefits from the high fiber diet or the high
great.
polyphenol diet more than another person, and
Yes.
do you currently use any available tests or parameters to make that decision?
So I use the in terms of symptom clusters. I use the mental health scales that we usually use for visits. I don't know that they're entirely effective, other than to give me a sense of whether on a scale the person's depression or anxiety, for example, might be improving. It from being much more of a generalized nutritional psychiatrist years ago when I started my clinic. I much more practice personalization with patients because I find that, I had a mother and daughter. The daughter just visited with the mother in the visit, and they had an opposite reaction to a healthy food. That I would have thought, wow, they should both be eating it, but actually the daughter had a reaction to it. So even though they're genetically, biologically related, they had a somewhat opposite response to the same healthy food. So I've learned through clinical experience and as research emerges that there are these nuances with individuals, and we have to formulate that plan in a much more personalized way. Another situation I would love to get your feedback on this too is individuals who have some type of gastrointestinal upset. They could have formal IBS, or they could just have struggled with dysbiosis without knowing it for years, and would come in. You can't just say, eat lots of fiber. If they have SIBO, you can't just say fruit and vegetables are important, because they can't often initially tolerate those. So again, if an individual comes in with those symptoms plus mental health symptoms, there have to be those nuances around the recommendations, and therefore it becomes more personalized. But I would love to get your take on that as well. We know we recommend fiber so much because it's such an important nutrient, yet there are people who cannot tolerate it initially.
Yeah, so there's let me answer that first, and then there's another question related to this as well. I personally believe in this, almost like human default diet. That I think there's
Okay.
something there's there's clearly regional differences in the world depending on what climate you live in, what
Mm,
you live at the equator, in the jungle, in the desert, in the on the North Pole, and that has developed in evolution, that humans and the microbiome adapt to these environments to have optimal digestion. So clearly, with the big migrations that happen today, with both refugees but also voluntary migrations, a lot of these people come to a place like the United States or to Europe, to a totally different
mm,
environment. And so
mm,
genetically and evolutionary, they may not be optimally adapted to this particular environment, and may have side effects to some of the dietary habits that do well with us.
mhm. Great.
In terms of, but I still believe there's for humans, some default diet. It's pretty general because you know, I think the ability of humans to have survived and have thrived all over the world in different areas is that they're extremely adaptable.
Mm,
And they can, yeah, I mean, I would say there's certain macronutrient requirements that are pretty universal, more or less universal. The micronutrient environments, I think that's, and the, you know, requirements for botanicals and phytonutrients, I think maybe more variable depending on where you come from, where your genetic makeup, where your microbial makeup is. But I usually start with this default diet, which is a largely, not exclusively, a largely plant-based
great.
diet,
Mhm.
um, with the addition of some seafood and some chicken as animal protein sources.
Mhm.
That's I've gotten a lot of criticisms from that, from vegans and vegetarians who often religiously defend
Right.
their complete avoidance
Position. Great.
of
Animal
animals.
products. Yeah.
So, and then, since I see a lot of patients with these digestive disorders,
Yeah.
I know there's about 5 items that people really, when they test it, may not tolerate
Mhm.
well. And I usually tell them to go through a trial period, starting with the complete, unrestricted diet. And then if they feel they get reproducible side effects to one or the other component, stop it for 2 weeks, monitor their
Mhm.
symptoms, reintroduce it for 2 weeks. If they really convince themselves that that is an item that they can't tolerate, um,
Mm.
I usually tell them reduce the amount, go to
Yeah.
half of it. So this is, for example, something with dairy products. A lot of people um, used to be able to drink large amounts of milk when they were children, but then
Great.
they only tolerate small amounts. And then I end up with this personalized diet by trial and error.
Mm.
And
Mm.
I personally feel people feel empowered by this because it's their
Yeah.
diet. It's not
Yeah.
something some committee, some Rome committee recommends to them, which
Right.
is the best for them. And to me, that is very important, this empowerment, that you're in charge, you're the expert, and you're in charge of what you eat.
Right. And I completely agree with what you're saying, because that autonomy of having the power at the end of your own fork makes people feel that they're leaving the office, even the virtual office, with things that they can do. I think um, when I was when I had to be in treatment for chemotherapy, it really was a big eye opener to be on the receiving end of medications, and how powerless that feeling is, or disempowering. You know that you have to take life saving medications, but at the same time you really don't have control. So I think, to your point, it's so important for people to feel that they can leave that visit feeling empowered with actual real suggestions, that they can take action upon. and not just general guidelines where they go to this. And I've had patients say this, they go to the supermarket and they're confused, like, should I get this or should I get that? If they have either list or breakdown of stuff or something that really suits what they're trying to do, that's the personalized component, they can take and make action steps, and they feel they're in control, and that if they're eating healthier, their families will follow, because one of them is maybe preparing for the family or purchasing the food for the family, all of which is important.
Yeah, I think this is a very important point, because unfortunately, patients are bombarded. So let's say somebody has digestive symptoms. So from their gastroenterologist, they get the recommendations that organizations or committees have come up with. And that changes every few years, because I've been in this business long enough to have seen the evolution often from one
Yes.
extreme to the other. So on the other hand, they go on the internet and then they are bombarded with messages from influencers. And
Yeah.
do you trust recommendation what you should be eating to improve your digestive symptoms from somebody who has 400,000 followers, or should you go with somebody who doesn't have that many?
Right.
So
Followers,
that's
but might actually be a well-vetted source. It's tough to it's tough for people to know, and I think that's an excellent point, because there are many influencers who have very large platforms, but their messaging is very specific, very niche to something that they believe, their philosophy, and I respect that. We're all entitled to our philosophy and our life path. But when it involves food and exclusion of certain food groups, I do feel that one has to respect that not everyone eats the same. You know, some people may want to eat chicken. Some people want to include meats in their diet. That's all they've eaten their whole lives. But we can encourage them to have a plant-rich diet, and others. So I feel like there has to be a balance. And if someone comes to me and says, I don't want to eat these products, it's not for me to say you have to. It's for me to try to find, well, what are the nutrients we could get you from other products, other foods that you can eat that can help you. I feel that that's an important discussion to have with individuals, because sometimes inadvertently or maybe deliberately, some of these influencers or individuals tap into a fear factor, which then really drives eating behavior. And when we come to nutrition or food or a diet through fear, that's just emotionally, psychologically never a good place. And so I think there's, it's the who should you take the advice from? It's how what is the messaging? Is it based on fear? Is it based on fact? Is it based on research? Is it based on research and a personal opinion, right? Because I'm sure if I said I can only eat these foods, I can find 100 studies to back that up. We know this, so it's a balance for people.
I think this is a very important point. It also, I mean, particularly this association of food with fear and anxieties, food-related anxieties,
Yeah.
gets into this whole area of orthorexia that you also mentioned in
Yes.
your book.
Yes.
So people have become obsessed with eating the right diet, and it's been mainly driven by some best-selling books about the horrible consequences you get from eating gluten containing
Right.
foods, or
Foods, right.
and I mean, again,
Leaving out a certain food. Yeah.
coming back to Dr. Chen at the Harvard Public Health School, who has written now several articles from these epidemiological databases, that this whole much of the gluten story has been a myth. It's not substantiated, but it's so deeply ingrained, this fear and this anxiety, that companies go to these extremes now. If you buy a bottle of water, it says gluten free on it.
I've seen that. I think that's hilarious. I mean, I just
but this is
but it's true. It's true. I've seen that. I
this is a
mean,
good point, that people are so afraid they don't even think about
yeah,
what water is, that they want to see
right.
that label.
They want to
So
see that label, yeah, and it then becomes a marketing ploy. I think you're absolutely right about that, because I think people don't. they don't often know what gluten is, to be honest, and they don't understand that there are actual healthy, real whole grains that you can be eating. I'm not a fan of, say, the sliced processed bread that we get in supermarkets. That I know that sometimes that's what people have access to, so I wouldn't fault them for ever eating that. But it's more, well, I know what goes into that. That's very different from an artisanal sourdough
Mm.
bread, right? Which is made with a fermentation process and a sourdough starter. So I think that if you eat gluten, just my suggestion is embrace it, but just find some better sources of it. You mentioned when we talked a little earlier that you ask individuals to, there's certain foods you think they might react to, so they might try short elimination. With anxiety disorders, I have done that because there's some research to link gluten with higher levels of anxiety, and in some individuals, not everyone, a slow elimination of certain types of gluten, but then reintroducing proper whole grains later on has worked. So, sometimes who knows in that instance, is it the highly processed, extra sugar, extra sodium, extra preservatives that's affecting them and driving the anxiety? But, sometimes it has been the gluten. But in general, I want people to eat the actual food and and not fear as much, because a gluten-free cookie or gluten-free cracker or whatever it is not necessarily healthy. That's a huge misconception. Often there's a high level of the wrong type of starch in a gluten-free bread. Um, many ingredients in so-called gluten-free treat or food that is actually less healthy for them.
Mm.
So it's often this the food labeling, the marketing also comes into that, like the gluten-free water, and it then drives the fear more. And I've had individuals come to me and say, "But I'm eating healthy and I'm only eating gluten-free cookies. How does that make the cookie that still has X lot ton of sugar in it? How does it make it healthier?" There's that feeling that if you say gluten free, it's associated with a certain level of health. So it's a lot of that people need to sort through in the choices they make.
Yeah, I mean, coming back to this, concept of orthorexia, which is where you could, other people have said that, the U.S. is suffering from a national eating disorder, which I tend to believe it's not like this in other Western countries. Certainly in the Mediterranean countries where food is still the enjoyment. And I always come back to this because it's such an amazing experience when you go through this yourself. That when you sit down and have one of these meals, they may not be perfect in terms of the individual elements, but the experience is so positive and joyous that
Yeah.
I strongly believe whatever goes on in your brain, in your emotion generating centers of your brain, is being transmitted to your gut and even to the gut microbes, and that will influence how you process that food and what happens with it. So as opposed, you come to this country. I mean, I always tell this experience I had on the plane from a meeting coming home from Barcelona, and there was a young couple, American couple, who had these sandwiches. I was sitting next to them, looked delicious sandwiches that they bought in Barcelona. And then they took these sandwiches apart and put all the delicious bread that the sandwich was made of on the side and threw it away. And I was asking them, so why are you doing this? And said, well, we cannot tolerate gluten. I asked them, do you have celiac disease? No, but we have terrible responses to gluten. So that's a good example. That fear, this poor couple goes to a place like Barcelona,
Right,
delicious food. Instead of enjoying it, they're worried about
right.
getting symptoms.
They
So
worry
that,
about gluten. Yeah, and I'll tell you that as I'm guessing you've experienced as well, individuals who are struggling in that way are pretty difficult to really help with proper nutritional recommendations, because they balk at inclusion of certain foods. a wider variety of just healthful options because they're very narrow about what they believe they should eat, um, and they perceive it to be healthy, but it has become so narrow that it actually is working against them and they don't realize. NADA, the National Eating Disorders Association, talks about orthorexia. And I feel like it's really much more prevalent in our culture than people realize. It's just not labeled that way,
Mhm.
but it's there, and we see it. We see it in many different demographics.
Yes. So coming back to your excellent book, so you have several chapters that deal with specific psychiatric disorders,
Yeah.
and if I ask you, your personal opinion of all these disorders, from PTSD to depression to anxiety, schizophrenia, kind of two related question. In which of these disorders have you had personally, or from your reading, the biggest success with incorporating nutritional psychiatry into it, um, and which ones would you consider so the least responsive to these interventions, to dietary interventions?
Right. So I would say the least responsive would be the individuals with orthorexia. Often may just um, they may have associated depression or anxiety and have come to me because they're struggling even with, say, insomnia, but they really struggle with me around making those changes. I would say the individuals that do much better, believe it or not, I've had a great deal of success working with individuals with diabetes, with comorbid symptoms of either anxiety. An individual came to me with symptoms of trauma and diabetes, another depression, just a few examples. But what was fascinating is that the mental health symptoms were varied in each case. But by helping them adjust the diet and teaching them those habits, like we spoke about at the beginning, meal planning, instead of dousing in orange juice when your Dexcom goes off or whatever it is, rather have healthy snacks, be planning your meals in a better way. I've had good success with individuals over time, lowering the amount of insulin, working collaboratively with the endocrinologist. I don't adjust the insulin, but I work with them. But we've worked on diet. We even, in several individuals, built in meditation because they were individuals who just wanted to learn some form of mindfulness, and it helped them reduce their anxiety as well. So it was all of those components. I would say that those range on the conditions I feel most proud about, because in the work, because I feel like we not only help the reduction of the mental health symptoms, the control of their diabetes became so much better. So I think that across the board, when individuals truly do the work, Dr. May, when they come in and they start to cut back on those problematic foods that are part of our standard American diet, and they start to focus in on these healthy nutrients, their symptoms improve. And I think it does require motivation, and it's a marathon, not a sprint. So people have to understand this is not taking a Tylenol and the headache's going to go away. This is going to be slowly and steadily eating in a way that's going to adapt our microbiome that could potentially impact positive change.
Yeah, this is really interesting that you said it's about, so that those patients who have comorbid physical diseases, together with their psychiatric symptoms, which is often the case. I mean, in
Very often,
Alzheimer's
yeah.
and Parkinson's, and
Yeah.
like and depression as well. I've sort of become really excited about this kind of almost like unifying theory that this low grade immune activation starting in the gut, diet induced, microbial mediated, and then spilling beyond the gut into the systemic circulation, that may be the unifying explanation for most of our this epidemic of chronic non-infectious diseases that we're dealing with today, and
Yeah.
may even play a role in susceptibility to long COVID or more severe COVID
Yeah.
symptoms.
Yeah.
Do you think that that's the main? I mean, there's other things that the microbes can produce. I mean, they can produce hundreds, probably thousands of metabolites,
Mm-hmm.
neuroactive metabolites from GABA
Yeah.
to. Um,
Yeah.
but to me, it seems the one thing that it makes the most sense, and what you said kind of confirms that, is this, counteracting this inflammatory state that is associated with our unhealthy diet.
I would agree with that. And also because more of the recent research that actually some of it was out as my book came out, but even more current research is really looking at inflammation being such an underpinning and underlying cause for depression, anxiety, cognitive disorders, and more. And I've had conversations with, individuals like Dr. Rudy Tanzi, who discovered one of the first Alzheimer's genes, and we've spoken about how impactful diet can be to lower the neuroinflammation component, right? That we don't necessarily have the medication cure, but we can definitely eat differently from an early stage. And I think, the misperception that Alzheimer's and dementias are diseases of the elderly. We all have brain changes. They're just not symptomatic,
Mhm.
and they may never become symptomatic, but how we eat could be one of the factors that helps us, by those anti-inflammatory molecules, by those polyphenols, by all of those foods. So yeah, I'm definitely with you on that. I think that inflammation is so it just has become to me a lot of the underlying problems that we're facing, and we know that how we eat in this country drives that, it drives
Yeah,
that.
yeah, yeah. So we've almost come to the end of this conversation. I could go on talking to you for a long time because
Me
a,
too,
lo-
me
a,
too.
lo- a lot of areas that I really value your opinion on. Just want to
Same
show
here.
this again. I'm going to ask you one last question at the end, but I don't want to forget to show your book again.
Yeah.
So anybody wants to read more about the topics of our conversation, I strongly recommend that. So the last question is a personal one, if I may ask. I mean, you mentioned it yourself. So you had a medical diagnosis, a
Mhm.
pretty serious medical diagnosis, and you have overcome this, and you've gone through um, a lot of reflections about your own health and lifestyle. So if you want to just spend a couple of minutes talking about it, and what is the main lesson in terms of the role of diet in having overcome this personal
Yeah.
challenge.
Well, I think I mentioned one of the lessons earlier on in our conversation was when you become the patient, you really appreciate that perspective of how there is doctors don't intend for it to be this way, but you feel quite helpless and you feel like you are asked to do things and you don't really have a choice. Um, and and it's the medical system is not intended to be that way, but it really gives you the vision of seeing treatment through the eyes of a patient. That was one very big lesson and was very humbling for me. And that is why I'm always so careful and respectful around any recommendation, even around food to someone. I want to really see it through their perspective as well and include them in the conversation. The other was that um, diet was so very powerful along with mindset. Initially, I was so anxious and I'm fortunately not an individual who struggles with that condition. But when I was given this diagnosis, it happened so rapidly, and things proceeded at such a pace that I found myself very anxious on the morning of my first chemotherapy treatment. And I realized I really had to spend a few minutes trying to grapple with it. I realized I wasn't doing what I was telling individuals every day in my clinic to do. I wasn't putting myself in that position and really leaning into the stuff I knew. I was generally eating healthy. I could have been managing my stress a whole lot better. So I really started to pay attention to that again and dove deeper into I'm eating healthy, but I'm now going to prepare everything at home. Part of it was you really can't eat out as much. for immunity reasons. And so I did that. I tapped into it, and inadvertently, I sort of tested out these protocols without intending to, and they became the blueprint of the work that I do today. So that was a very powerful experience for me, especially when my doctors would ask me every week, "What are you eating? What are you packing in your lunch this week for your chemo?" Because you're not having the side effects, and they were very happy about that, but they wanted to understand it. Um, so I think that those were the pluses of having gone through what I did, um, and I think that it was a very big, very humbling learning experience for me. So thank you for asking.
Yeah, thanks for sharing this. And again, I mean, thank you so much for spending this time with me to talk about a topic that I'm sure is of wide interest in the lay community and amongst patients. So yeah, thanks again. And hopefully, we'll have another opportunity in the future to meet in person.
That would be wonderful. Thank you so much for having me. I really like it. Like you said, we could go on for quite some time if we had it available.
Okay, bye-bye.
Thank you so much. Take care.